there, my name's Alexis. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Edward Landon, 11/26/03.
Okay. All right. I'm going to close this curtain for some privacy. And is it all right if I go ahead and touch you and take a look at your wristband?
Yes.
Okay. All right. Perfect. Okay. So your doctor has ordered some vital signs and a quick assessment. Now, for the purpose of this video, I'm not going to do vital signs right now, but I know we have to document them. But I'm going to go ahead and go through my pain assessment. So can you tell me what brings you in today?
Yeah, my hand is hurt.
Okay, so
Yes.
You're having some pain in your hand.
That's correct.
Okay, and can you kind of like describe that pain to me?
Well, there's a lot of swelling, so it's dull pain.
Okay.
Dull.
All right, and can you tell me what happened when you were doing this?
Yeah, I got shot by a paintball.
Okay, all right. And can you tell me it's in this region, like where exactly it is?
Yeah, it's on the right side of the hand.
Okay, and do you mind if I take a look at it, touch it and everything, just kind of feel?
Mm-hmm.
Okay, all right. Does that hurt more here than here? Or is it about the same?
It's about the same.
Okay.
Yeah.
And so when did this happen?
Probably about 6 hours ago.
6 hours ago? Okay. And how does this how is this affecting your life so far?
Well, I've lost a lot of grip strength already.
Okay.
But I think it's because of the swelling.
Okay.
Yeah.
All right, perfect. And are you allergic to anything?
Not that I'm aware of.
Okay, perfect. So I'm gonna go ahead and start with my lung assessment. So it's just gonna feel like a light, tap on your chest, and every time I lay it down, if you'll just take a deep breath for me.
Gotcha.
Okay. All right. So I'm going to take my patient's anterior breath sounds first. Okay. Now I'm going to take my patient's posterior sounds. Okay, now my patient's left lateral side. Okay, and now my patient's right lateral. Okay, my patient's breath sound unlabored, bilaterally symmetrical. I don't hear any adventitious sounds. And do you happen to have a hard time breathing regularly?
No.
No? Okay, all right, and have you had any mucus recently, anything like that?
Yeah, I was sick about 2 weeks ago.
Okay, so you have had some mucus. All right, well that concludes my respiratory assessment. Now I'm going to move on to cardiovascular. So that, again, it's going to be the same thing, just feel tight taps on your chest, just listening to some of your valve sounds, okay?
Gotcha.
All right, and do you take any type of heart medication?
No.
All right, do you have anyone in your family that has a history of cardiovascular diseases?
Not that I'm aware of.
Okay, all right, perfect. So if you'll just move your leg for me real quick. Okay. So I'm going to listen to my patient's first aortic valve, which is on the second intercostal space on the right side. Okay, now I'm going to move over to the left side and listen to the pulmonic valve on the second intercostal space. Now I'm going down to the third intercostal space, listening to the Erb's point. Moving down to the fourth for the tricuspid. And then the fifth for the mitral valve, which is also known as the apical pulse. Okay, so my patient has a steady rhythm, everything sounds good. For the case that if they had S3 or S4 sounds, or there was any type of heart murmur or lower sounds that I couldn't hear, I would use the bell, but for the purpose of this demonstration, there were no sounds, so I just used the diaphragm. All right, and now I'm going to go ahead and look for jugular vein distension, and what this is just checking to make sure that your jugular vein is not protruding or anything like that, okay? If you'll just stand still for me, I'm just going to shine this light to take a look. Okay, everything looks good with jugular vein. Now if you'll just kind of turn for me a little bit, and I'm going to go ahead and feel all of your pulses throughout your body, okay? So if you'll just stay still for me,
Yep.
I'm going to explain them to you, and then we'll move forward, okay?
Sounds good.
All right, so first I'm going to feel your carotid. All right, now if you will hold your arms out like this for me.
Okay.
I'm going to feel under here for your auxiliary, okay? And then this would be your brachial pulse. Okay, I'm going to feel the radial pulse. Okay, everything on my upper extremities are good as far as pulses. I'm now feeling for edema, looking for any types of bruises and swelling. I do notice a little bit of swelling here. I'm assuming that's from paintball.
That's correct, yeah.
Okay, all right, everything feels good bilaterally. Now if you'll hold your hands out for me like this, I'm going to check my patient's capillary refill. Okay, refill is within 3 seconds. Perfect. So everything upper extremity wise looks good. I'm now going to proceed to the lower extremities.
Okay.
So I'm just going to feel right here. It's just your femoral pulse. So if you can move your hands for me. All right, this is where my patient's femoral pulse is. Now I'm going to move down to our popliteal pulse under the knee. If you'll just extend your legs for me. Okay, perfect. All right, you can bring it back. And now I'm going to be checking my patient's pedal pulse, which is on the top of their feet. Okay, and then also the back towards the ankle is where the popliteal tibialis is, so I'm feeling for that now. All right, I'm just going to feel for some edema, make sure there's not any sort of swelling. Okay, perfect. So everything looks good. You have great symmetry, like everything's looking good as far as edema-wise. Let's see. Now I'm going to go ahead and explain to you what this is. This is called an incentive spirometer. So this is a device that you would use for breathing techniques to help, expel any type of mucus or anything that you have in your lungs. So you would turn, cough, and deep breathe with this device. And if you are, obviously you're not a bedbound patient, so if you were to be bedbound, you would breathe, and then you would turn over, and then you would cough every 2 hours, okay, on the spirometer. Now, since you're not bedbound, you would take 10 deep breaths every 3 to 5 seconds, for 3 to 5 seconds every hour, okay?
Okay.
All right. So now I'm going to be moving on to our safety portion. This is just going to be letting you know protocols that you should be following at home. Okay. Do you happen to have a history of falling?
No.
Okay. And do you have a relatively cluttered house?
No, not like the walkways, no.
Okay. And do you have like a lot of rugs, a lot of like frills on your rugs and everything like that?
We do have some rugs, but they're not pulled up or anything like that. They're safe rugs.
Okay. And do you have any pets in your house?
I do, yes.
Okay, so as far as the rugs, to remain safe, you want to make sure that you're keeping them in a good position, that you're watching your floorways, watching over your pets. I know they can be a huge issue sometimes, so just be aware of that. And also, if you happen to see things on the floor, try to remove them because that can be a safety hazard. And yeah, that's pretty much everything.
Awesome.
Do you have any questions?
No.
Okay, perfect.